The attorneys for a woman charged with assault are furious that she's been sitting in jail for 5 months waiting on mental health treatment. They say this is a situation happening all over the state and something must change. They argue the State Department of Mental Health is not doing enough, but the department says it's doing all it can. News on 6's Caitlin Deggs explains what this means for hundreds of inmates all over Green Country. Caitlin.
Lori, attorneys for Dalia Shahada say her case is just one example of many who are in desperate need of mental health care and ended up sitting in jail way too long waiting. The Department of Mental Health says they can only admit as many people as they have rooms available. Dalia Shahada was booked February 10th in the Tulsa County Jail and was found incompetent to stand trial, but it was determined she could be found competent with the right treatment. The Oklahoma Forensic Center for Mental Health Treatment is the place for that, but they have 212 beds and a long waiting list. So Shahada sat in jail 5 months waiting. Her attorneys say this just isn't acceptable.
These people need treatment. Jail is not a therapeutic environment. There is no mechanism in jail to help these people attain competency, and without that, there's no way for their cases to move forward.
Janae Clority says there are many people who sit in jail much longer than 5 months who are waiting on mental health treatment to become competent. She says just in Tulsa right now, more than 30 people are waiting for treatment.
Jail competency is not working. It is not even occurring in this county, and these people need treatment. It doesn't matter if you've been accused of a crime. It doesn't matter what you've done. If you are mentally ill and you are in jail, you need treatment so that you can address your case.
The state mental health department said in court documents it sends people to the Oklahoma Forensic Center as soon as a bed becomes available for them. But they're at capacity because it houses people needing treatment to become competent, as well as people found not guilty by reason of insanity. The department says it gave mental health treatment to Shahada while she was still in jail, and then once a bed was open, moved her to Veneta. Shahada's attorneys say they will keep fighting to bring attention to this crisis and get people treated sooner rather than later. The department tells us that it only has one forensic facility that can treat these people, and it serves all 77 counties with only 200 beds. The department also says it will add more than 80 beds to the center next year. Caitlin Deggs, Oklahoma's Own, News on 6.